Please be seated. Thank you. Well, good afternoon, everyone, and thank you for joining us here today. This is the HHS briefing on the China coronavirus, and we aim to do two things today. Provide the American public with an update on the risk presented by the virus and provide the latest update on the actions that President Trump's administration is taking to respond to the outbreak and keep Americans safe. I'm joined today by Dr. Ann Schuchat, the Principal Deputy Director of the Centers for Disease Control and Prevention in Atlanta, Dr. Tony Fauci of the National Institute of Allergy and Infectious Disease, Dr. Robert Kadlec, HHS's Assistant Secretary for Preparedness and Response, and Dr. Stephen Hahn, the Commissioner of Food and Drugs. As of this morning, we still have only 14 cases of the China coronavirus detected here in the United States, involving travel to China or close contacts with those travelers. We have 3 cases among Americans repatriated from Wuhan, and we have 40 cases among American passengers repatriated from the Diamond Princess in Japan. I want to thank the responders and communities that have worked with HHS and the administration to provide these Americans with the treatment they need. I'm also grateful to the governors and other state and local leaders who have worked with us in close partnership so far. The immediate risk to the general American public remains low. But as we have warned, that has the potential to change quickly. There is now community transmission in a number of countries, including outside of Asia. That's deeply concerning, and community spread in other countries will make successful containment at our borders harder and harder. That's why we've already been working closely with state, local, and private sector partners to prepare for mitigating the virus's potential spread in the United States, because we will likely see more cases here, as we have said throughout this episode. Dr. Schuchat will provide some more details on what that will look like, including how we would treat potential cases that arise from community transmission here in the United States. This preparation has been possible in part because of how aggressively President Trump has responded to this outbreak. As soon as we knew of the threat presented by this novel virus, public health leaders were monitoring it and beginning to prepare. The travel restrictions that the President put in place at the beginning of this month have given our country valuable time to continue to prepare, and that is precisely what those measures were designed to do. That includes working with Congress. Yesterday, the White House sent a request to Congress to make at least $2.5 billion in funding available for preparedness and response. There are 5 major priorities within the supplemental request, which I underscored this morning before the Senate Appropriations Committee. First, we need to expand our surveillance work, building on an existing system we have within CDC's influenza surveillance network. Second, we will need funds to support public health preparedness and response for state and local governments for what could be a very large-scale response. We don't know, but we must prepare for that just in case. This support complements the significant funds that these partners have received from CDC for preparedness, about 2/3 of $1 billion a year in recent years. Third and fourth, we need to support the development of therapeutics and the development of vaccines. Given the scale of this outbreak, the private sector sees a real market for both kinds of countermeasures, as well as for diagnostics, but federal funding and guidance can accelerate this work. Dr. Fauci will address the current status of that work in more depth. Fifth and finally, we need funds for the purchase of personal protective equipment for the Strategic National Stockpile, a topic that Dr. Kadlec can address. I'll conclude by noting that though scheduling conflicts prevented this briefing from including other members of the President's coronavirus task force, we'll be providing a new update from interagency leaders soon, and we expect to continue doing so regularly. Earlier this afternoon on CNBC, the National Economic Council Director Larry Kudlow offered an update on how we see this outbreak affecting the economy. This morning, Dr. Messonnier from CDC provided the usual telebriefing. As Dr. Schuchat will emphasize in just a moment, The Trump administration will continue to be aggressively transparent as the outbreak and our response evolve. We'll continue keeping the American people and the media apprised of the situation, as well as what everyone can do to prepare. In the meantime, I'll continue to work closely with President Trump and the President's task force on our preparations to keep Americans safe. With that, I'll hand things over to Dr. Schuchat for an update from the CDC. Dr. Schuchat?
Well, thanks so much. I'd like to start out by saying it's a difficult and uncertain time. We, along with our partners around the country and around the world, have been confronting a dynamic, rapidly evolving situation. I'd like to let Americans know that CDC and our nation's public health agencies are preparing every day for this type of situation. Preparedness started long before this outbreak. The U.S. government's response to the spread of the novel coronavirus into our country began as soon as reports of an unidentified flu-like illness emerged from Wuhan, China. The U.S. has been implementing an aggressive containment strategy that requires detecting, tracking, and isolating all cases as much as possible and preventing more introductions of disease, notably at ports of entry. We've restricted travel into the U.S. and have issued multiple travel advisories for countries currently experiencing community spread. Our travel notices are changing almost daily as we get new information. And we believe these precautions are working. So far, as Secretary Azar described, our public health system has detected 14 cases in travelers or very close contacts of travelers here in the United States. Among passengers repatriated by the State Department from Wuhan, China, and from the Diamond Princess, there are an additional 3 and 40 cases. The fact that we have been able to keep cases to this low level is an accomplishment, especially given that we are unfortunately beginning to see community spread in a growing number of other countries. Based on what we know right now, we believe the immediate risk here in the United States remains low, and we're working hard to keep that risk low. But we must use this time to continue to prepare for the event of community transmission in the United States. Part of that preparation is educating the public and our state, local, and private sector partners about what transition from aggressive containment measures to community measures or community mitigation would look like should we end up there. Under our current aggressive containment posture, patients infected with the coronavirus who have mild or no symptoms are being placed in healthcare facilities for very close observation and isolation. That intensive level of medical care is not typically needed. As we've watched these cases and learned over the past several weeks, we realize that other approaches to management are likely fine. Outside this period of aggressive containment, the usual and appropriate care for most patients who develop the novel coronavirus or COVID-19 would be management at home through home isolation, with use of healthcare facilities only as needed for those who have severe presentations, the elderly, those with medical conditions requiring closer observation. We will maintain for as long as practical a dual approach where we continue these measures of aggressive containment to this disease, but also employ strategies to minimize the impact on our communities. However, current global circumstances suggest it's likely that this virus will cause a pandemic. In that case, risk assessment would be different, and new strategies tailored to local circumstances would need to be implemented to blunt the impact of the disease and further slow the spread of the virus. What these interventions would look like at the community level will vary depending on local conditions and on the emerging information about how severe the virus may be. Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease. We have been preparing to address this type of threat and limit the impact on our communities for many years. As some of you heard from Dr. Missonier of the CDC today, we've begun laying out for the public what it will look like to mitigate the spread of the virus. There are obvious common sense tools like good hygiene, social distancing, things like staying home when you're sick, things we talk about during a difficult flu season, or things that we talked about during the 2009 H1N1 pandemic. We will be transparent with the public about these measures and the potential that these tools will be necessary. There is literally a playbook for the use of these tools, and one that the states and local public health have exercised. We are committed at the CDC and across HHS and the U.S. government to radical transparency, to making sure we're sharing what we know when we know it, and we're giving you a sense of what the future may hold. I'd like to now turn things over to Dr. Fauci for his update.
Thank you very much, Anne. I'm going to give you a very brief update on the countermeasure development that I introduced to this audience on a number of occasions over the past couple of weeks. And the first regarding the issue of vaccine. You might recall that I had mentioned when we first introduced the topic of vaccine that very shortly after the sequence was put on a public database, we began a vaccine development program, which was one of several supported both by the NIH as well as BARDA from ASPR, and even independent individuals that we have been involved in collaborating with for a period of time. One of these vaccines, I think, serves as the prototype of the timing of what we were talking about. You might recall I had mentioned that from the time we had available sequence, we would hope to be in clinical trials within 2 to 3 months. And I said, barring any glitches, that would be the fastest ever in any vaccine that we've gone from the identification of a pathogen to putting it into a human in a phase 1 trial. Well, I'm happy to report to you this afternoon that we are on time at least, and maybe even a little better. The gene has been expressed in the platform, in this case a messenger RNA. The material has been produced. It's been put into mice. It's immunogenic, and it's now getting ready to go through the regulatory issues of getting it to go. So I would project that we would be in a human trial, I would say within a month and a half, and I had thought that maybe cut a week or so off. Again, hopefully no further glitches. Now, the thing we need to understand, because we want to make sure people don't get confused, that getting a vaccine into a phase 1 trial within a 3-month period, you need at least 3 to 4 months to determine if it's safe and whether it induces the kind of response that you would predict would be protective. Once you do that, you graduate to a much larger trial. The N of the number of people in the phase 1 trial is 45. When you go to a phase 2 trial, you're talking about hundreds, if not thousands of individuals to determine efficacy. That is a trial that we would have to conduct in those countries and those areas where there's active transmission. That itself, even at rocket speed, would take at least an additional 6 to 8 months. So when you're talking about the availability of a vaccine, even to scale it up, you're talking about a year to a year and a half. Now, you shouldn't be discouraged by that, because it is certainly conceivable that this issue with this coronavirus will go well beyond this season into next season. So a vaccine may not solve the problems of the next couple of months, but it certainly would be an important tool that we would have, and we'll keep you posted on that. Secondly, and finally, the issue of therapeutic interventions. There are a number of candidates that we are now looking at that have shown some suggestion, either in vitro, in an animal model, or some empiric trials that were done during the MERS outbreak. One of these, and there are several that we're considering, is called remdesivir, which is a nucleotide analog that is produced by Gilead. Today, as I speak, there are 2 major clinical trials going on in China, which are randomized, controlled trials, which means that we will get an answer whether or not it works or doesn't work, I think, within a reasonable period of time. An identical copy of that trial is now being implemented in Nebraska with our colleagues who are taking care of the individuals who were taken from the Diamond Princess and brought back here, in addition to our colleagues in Japan. So I'm optimistic that we will at least get an answer. If we do have a therapy, that really is a game changer, because then we could do something from the standpoint of intervention for those who are sick. So hopefully I'll get the opportunity in the future to continue to update on these interventions. Thank you. I'd like to introduce Dr. Catlett.
Dr. Fauci, thank you very much, and good afternoon, everyone. ASPR is providing unprecedented operational and logistical support to the State Department to repatriate approximately 1,100 Americans from China and from the Diamond Princess cruise ship in Japan. We are pleased that the passengers evacuated from China have completed their 14-day quarantine and have returned to their homes and families safely. Passengers evacuated from the Diamond Princess are in the process of completing their 14-day quarantine at 2 DoD installations, one in California and one in Texas. Medical professionals from our National Disaster Medical System and CDC are continually monitoring the health of these passengers. Any passengers who show signs of any illness are moved off the DoD facility and tested for this virus. Passengers who are tested positive for this coronavirus cannot stay on the military installations, and these patients are being transported safely to our network of special pathogen treatment centers, such as the University of Nebraska Medical Center, as part of our aggressive containment posture. These individuals are being placed in these facilities for quarantine and isolation purposes only. An intensive level of medical care is not typically needed by most of these individuals. At these centers, the patients who develop this infection can participate in the clinical trial that Dr. Fauci described with remdesivir. We are honored to have helped NIH to arrange that clinical trial within this special network of treatment centers. In addition, our Biomedical Advanced Research Development Authority, BARDA, is working with Regeneron to develop 2 possible treatments, and with Janssen and Johnson & Johnson to screen existing and investigational treatments and compounds to identify any that have potential use in treating coronavirus, and with Janssen and Sanofi to develop vaccines using vaccine technology that the HHS supported for pandemic influenza vaccines. We're reviewing hundreds of proposals for additional therapeutics and vaccines, and in particular diagnostics that can be used in hospital and clinical labs or doctors' offices. We're also prepared to support CDC and Department of Homeland Security at designated military installations where Americans returning to the U.S. on commercial flights can be quarantined based on their travel history. The most recent location to receive such a traveler is the naval base at Ventura County, Point Mugu, where one American is currently completing quarantine. Any quarantine at any of these military installations would not have any symptoms or a positive test result. Quarantine is based solely on their travel history that places them at high risk for possible exposure. Their health is continually monitored, and they're transferred safely to medical facilities for testing and treatment if any symptoms develop. It is now my pleasure to introduce Dr. Stephen Hahn from the FDA.
Thank you, Dr. Kadalik, and thank you for the opportunity to update you today on FDA's coronavirus activities. The FDA plays an essential role in overseeing our nation's medical products as part of our vital mission to protect and promote public health, including during public health emergencies. The FDA is an active partner in the novel coronavirus response, working closely with our government and public health partners across the U.S. Department of Health and Human Services, as well as our international counterparts. Our work is multifaceted, focusing on actively facilitating efforts to diagnose, treat, and prevent the disease, surveilling the medical product supply chain for potential shortages or disruptions, and helping to mitigate such impacts as necessary, and leveraging the full breadth of our public health tools as we oversee the safety and quality of FDA-regulated products for American patients and consumers. I'm happy to answer questions about FDA's activities, but I'll provide a few updates. First of all, the supply chain. FDA is keenly aware that the outbreak will likely affect the medical product supply chain, including potential disruptions to supply or shortages of critical medical products in the U.S. We are proactively reaching out to hundreds of medical product manufacturers to gather information about the supply chain. First, it's important to note that FDA is not aware of any medical product shortages at this time. We are, however, monitoring several products that might be at risk, particularly personal protective equipment, but we do not have any manufacturer shortages to report. Please be assured, if a potential shortage or disruption of medical products is identified by the FDA, we will use all of our available tools to react swiftly and mitigate the impact to U.S. patients and healthcare professionals. And we will take steps to quickly share that information with the public. With respect to inspections, for February and March, FDA has identified approximately 100 scheduled inspections in China, the vast majority of which are routine surveillance inspections. Those inspections are just postponed at this time and will be conducted at a later date. It's important to remember that these delayed routine surveillance inspections can happen at any time during the year. And while inspections in China are delayed secondary to the State Department travel advisory, we will send investigators to other parts of the world to ensure we are on schedule for our planned inspections for the year. Also would like to remind everyone that the inspections are just one tool that FDA can use to monitor compliance and to help prevent products that do not meet FDA standards for entering the U.S. marketplace. This process has a number of layers in place and is not solely reliant on boots-on-the-ground inspections. Overall, this remains an evolving and very dynamic issue that we will vigilantly monitor. We are committed to continuing to communicate with the public as we have further updates. Thank you.
Great. Thank you, Dr. Hahn. At this point, why don't we open it up for questions? Yes, here. If you could just wait for the microphone so the TV cameras can hear your question.
Thank you, Secretary Arthur. I'm Olivia Zhang with China's Taixing Media. My first question is, as China's coronavirus cases seems to be contained, while there are other countries like Italy, Japan, or South Korea seems expanding, I wonder, are you considering loosening the travel restrictions regarding foreigners with travel history from China, while considering imposing travel restrictions with, travel histories regarding the above three countries? And also, I noticed that you were still referring the COVID-19 as China coronavirus. Well, I think WHO changed this to COVID-19 because they think the China coronavirus might lead to xenophobia or racism. Do you think it's proper to still refer it to China coronavirus? Thanks.
So we intend to keep our travel restrictions with regard to China in place at the moment. The virus is still spreading in China. We're still having hundreds of case reports per day. If that's capturing all of the information, we're still seeing dozens or more fatalities reported per day. We certainly hope that China is able to engage in effective containment measures to slow the spread of this virus down, but there's nothing at this point that would indicate a change in our posture towards our aggressive containment measures with regard to travel in China. It's important, though, to remember we've been very moderated and titrated in those travel measures. They simply are based on 14 days, which is the maximum predicted incubation period. And so an individual who has been in China for the previous 14 days, who is a foreign national, would not be permitted to enter the United States, and an American or permanent resident would be permitted to return to the United States, of course, but asked to home isolate during the completion of a 14-day period outside of China. That is not a ban. That is a temporary restriction in line with the public health measures that we're taking. So we've tried to be very respectful towards travel. And of course, those restrictions are not based on other than American and permanent resident versus non-Americans, really as a matter of focusing our resources. They're not based on the ethnicity of an individual or anything else, because as you mentioned, it is important that we not engage in any, that people not believe that because of somebody's ethnicity, they are more likely to have this disease or not. Our criteria are all based on travel in affected areas and warning people about travel in infected areas based on the epidemiology and the evidence. So, Brianna, did you have her? Yep.
So thank you, Secretary Azar. So the CDC said this morning that Americans should prepare for their everyday lives to potentially be disrupted by the inevitable spread of the coronavirus in the U.S. Your comments haven't gone quite as far, and the president also tweeted that everything is under control. Can you address the difference in messaging? And then secondly, given what you know now, are you expecting community spread in the U.S. in the near future? And how confident are you that the U.S. is prepared to respond?
Okay. Let me ask Dr. Schuchat if she could speak to the CDC's discussion this morning. Thank you.
Yeah, thank you. I think Dr. Missonier talked about the potential for community transmission and helping Americans think about what that would mean. I think to help Americans frame what to expect, it's helpful to think about a bad flu year or even the 2009 pandemic, where in different locations at different times, the circumstances require different measures. The idea of exactly what that will look like in the United States is hard to say. And of course, the images we've been seeing from China, from Hubei province, are quite different from what we would expect in the U.S. context. So I think what's really important for people is to stay informed, stay aware, and to learn about the circumstances. We really think everyday measures like covering your cough or sneeze, staying home when you're sick, are very important. And of course, the evergreen wash your hands. We do know that at the beginning of the H1N1 pandemic, schools were closed. That's one of those social distancing, community mitigation tools. Well, schools were closed briefly until we learned more about the virus and what to expect, and we realized that the trade-off between the disruption of school closures and the benefit of school closures for that particular virus, the equation suggested we didn't need to do that, and instead we moved to a message of children staying home when they were sick. So I think Dr. Missonier's comments were really to frame what might happen in the future. It's very important to say that our efforts at containment so far have worked, and the virus is actually contained here in the United States. We don't want to delay thinking about other possibilities, and it was really an educational moment that she talked about.
Yes?
Yeah, hi, this is Issam Ahmed with AFP. Just on the transmission, I understand it's primarily respiratory, but is there any more confirmed information about the possibility there have been a few isolated papers on asymptomatic and the fecal-oral route? And for the FDA, the question was, what sort of personal protective equipment are we talking about, face masks and that sort of thing?
Yeah. Great. Let me ask Dr. Fauci, perhaps, and then Dr. Hahn.
So anecdotally, it's clear that there are people who were judged to be asymptomatic when questioned, who very likely transmitted infection during the period of time that they were in the asymptomatic state. The question is that a predominant modality of transmission, what we call a driver of an outbreak, or is it one that's minor? From talking to people who are over there now, and we're getting more and more information as papers come in to look at, to review, it looks like, A, it does occur, but B, it is not something that is the predominant way that it's transmitted. Now, obviously, you need to be aware of that in issues of testing and things like that, but I think we're getting closer to a better understanding of that.
In terms of PPE or personal protective equipment, we're talking masks, respirators, gowns, and there's no question that there's pressure on the demand side here. So we're keeping a very close eye on this and a forward-leaning approach because we may in fact see some effect on the supply chain there.
Yes.
Sophie Tatum with ABC News. Earlier today, members of Congress had a lot of questions about whether or not the emergency supplemental request would be enough. And I guess, can you kind of offer some insight in how you guys came to that number and why you feel like that will suffice?
Sure. So the supplemental request would authorize $2.5 billion of spending. First, it's important to know that's money to be spent in 2020. So that's between now and September 30th of this year. We would have a provision authorizing carryover spend into 2021 fiscal year if needed, but it really is this year's spending. And what we told the appropriators is we're in the middle of looking at the next year's appropriation. So let's work together on that on top of, in addition to any additional needs. And we'll have a lot more learning. We're learning every day and every week more about this virus and the disease progression, and that will help inform those longer-term discussions about 2021. Now, as to the $2.5 billion, as I said, 5 key areas. First, we've got to expand our surveillance system to be more comparable to what our flu surveillance system is like. We want to test people with flu-like symptoms or any potential symptoms that would resonate with the coronavirus so that we can ensure that we have rapid detection if anybody's getting this. So that's part of the scale up there. The second is our state and local partners are the front lines of any kind of public health response. We fund about half of state and local public health already, and $675 million a year of emergency response, but we know there will be additional needs with lab testing, contact tracing, et cetera. Third, vaccine R&D. Dr. Fauci talked to you about that. We want to put multiple bets on the table. We have $1 billion in there for vaccine development. We want to have multiple bets on the table. We want to speed that along as quickly as possible. Now, we can assess whether there's a need for us to make the market in terms of purchasing. Frankly, this has such global attention right now, and the private market players, major pharmaceutical players, as you've heard, are engaged in this, that we think that this is not like our normal kind of bioterrorism procurement processes where the government might be the unique purchaser, say, of a smallpox therapy. The market here, we believe, will actually sort that out in terms of demand, purchasing, stocking, et cetera, but we'll work on that to make sure that we're able to accelerate vaccine as well as therapeutic research and development. Multiple bets on therapeutics also, as Dr. Fauci referred to. And then Dr. Kadlec will lead our efforts, in addition, on personal protective equipment procurement, for instance, scaling up acquisition of N95 face masks, which would be primarily used for healthcare providers to protect them in multiple interactions in the community. Our advice remains, as it has been, that the average American does not need a N95 mask. These are really more for healthcare providers, and also gowns for use in hospital settings, gloves, et cetera. It's that type of equipment that we would add to our existing stockpiles there. Thank you. Yes, back there.
Secretary, Chris Van Cleave, CDC.
And then we'll go to you. Thank you. Please, sorry.
What you guys are saying, what the CDC are saying is it's a little different. I think people are a little confused. On one hand, you have the president saying, I think it's going to be under control. Mr. Kudlow saying it's tightly contained. You have Senator Graham saying it seems to be getting worse, not better. And the CDC saying that Americans need to prepare because this might get bad.
Yep.
Which is it, and what exactly do they need to do to prepare?
So I'm going to ask Dr. Schuchat to talk about some of the advice, but let me start by saying we're trying to engage in radical transparency with the American public as we go through this. Each of those messages is accurate, but addresses a particular aspect of what we're talking about. So, for instance, abroad, this is spreading quite rapidly. In the United States, thanks to the President and this team's aggressive containment efforts, this disease, as Dr. Schuchat said, is contained. We are now 2 weeks with no additional U.S.-based cases. 14 cases on February 11th, 14 cases today. That is remarkable level of containment here in the United States. The only additional cases we have are ones we imported as part of our humanitarian repatriation efforts. Then we tried to be very transparent with the American public. We have from day one said we can't hermetically seal off the United States. I stood here at this podium, I stood at the White House press briefing when we announced our initial travel restrictions, and we've always said we expect to see more cases. We don't want people surprised if they see more cases here in the United States. That's an important part of transparency. People shouldn't panic when they see new cases. They should know their government predicted we would have them, and we have plans in place. And then that gets to what Dr. Messonnier was talking about this morning, which was just previewing for the American people that as we see additional cases, we actually have tools. We may not yet have a vaccine or a therapeutic. We have public health tools of mitigation that we can and will use, and it's important for people to know we aren't helpless. We have tools. We have, as Dr. Schuchat said, we have actually a defined playbook for taking steps to help if we do see community spread. How broad any type of community spread, we do not know. It is very dangerous to make predictions with a virus, especially a novel virus. But we have tools to deal with it that are reasonable, titrated, and don't excessively interfere either with the economy or individuals' lives necessarily. So all of this it's part of the same message, which is this is a very serious public health condition worldwide. We are taking this incredibly serious here in the United States. We are doing the most aggressive containment efforts in modern history to prevent further spread in the United States. We're going to continue taking those measures, but we are realistic that we will see more cases, and as we see more cases, we might have to take community mitigation efforts. What will those look like? We're being transparent about those also. So it's all to make sure that the American public go on this journey educating with us. We're keeping people fully informed of what will happen, almost so that people could predict what we would do and what we would say in advance, because we have been so transparent about what our playbook is and how we think about these issues. I don't know, Dr. Shukett, if you might.
Mr. Secretary, if I can ask a quick follow-up to what you just said there. Do you understand why saying things like prepare to have schools closed and have plans for your kids for daycare, be prepared for telework, you have members on the Hill asking or telling you they don't think the U.S. is ready. Do you understand why that set off some alarm bells?
I can't account for people on the Hill and what they say. We are, yeah, but what.
Hear all of this on the news tonight. You know, it set off some alarm bells for folks.
And I'd like Dr. Shukett to discuss what Dr. Messonnier was speaking about, which again is about transparency about potential actions or measures in the future. Part of preparedness is an educated population thinking about the future. We hope those steps aren't necessary. We hope that we don't face those kind of eventualities. But transparency is being candid with people about what the continuum of potential steps are, so that they can start processing in their own heads, thinking about in their own lives what that might involve. Might involve, not will. We cannot make predictions with any degree of certainty about how a virus will spread or what will happen. What we can say now is that thanks to our aggressive containment efforts, we have contained the spread of this into the United States, 14 cases now for 2 weeks solid. And we're going to keep working to contain the spread of this. But if we need to, we'll take appropriate public health measures to help mitigate that. Dr. Shukett?
Sure. Yeah, and just to kind of elaborate on the steps, when we think about communities measures, not just the aggressive containment, around each individual case, what we do and around all their contexts, we think about the individual or personal steps at mitigating spread, things like staying home when you're sick. We think about the community steps, things like a different approach to gatherings. Perhaps if you're elderly with underlying conditions, you might not go to that big concert, and others could. We also think about environmental measures, things like cleaning commonly touched surfaces a little bit more than you might otherwise. A big focus is the healthcare system and really using it appropriately and not overusing it or underusing it, and helping the healthcare system be prepared, but also helping consumers, patients know what to expect when they want to seek care, when to call a nurse line instead of going to the doctors yourself. So I think this playbook that Dr. Messonnier laid out was really foreshadowing the kinds of things that we may need to do. Of course, we've been watching the situation in China closely, and then, of course, the recent emergence of community spread in Italy, in Iran, in South Korea have raised questions with people of what might happen here. We want people to be ready in terms of, if we do see community spread, what would that mean to you? Maybe something different in your community than another community, depend on local circumstances, but we wanted people to look at what that roadmap might be. We do think that we've done mitigation before. We've learned from the past in terms of what was appropriate, what perhaps was overkill, and we want to educate folks about what we've learned and what they can expect.
So could you put into like one sentence, when she says get prepared, what that means if you're, if you're a parent versus if you're my parents in their 70s versus parents of a young child versus me?
Yeah, what I would say is cdc.gov. There are checklists there for businesses, for employers, for schools, for consumers, for travelers. We've already been educating the public about travel. Here are some places to watch. There's an outbreak, but it's contained. Here are some places where we suggest no travel, do not travel unless it's absolutely essential. So I think that the circumstances are changing, and staying informed is the best thing that people can do. And that's really what I would advise.
Dr. Fauci, well, would you Dr. Fauci,
So
you've had your spotlight. Let Dr. Fauci answer the question.
I see what you're getting about when you ask the question, what you should do. What Dr. Messonnier was saying, nothing that you should do right now, but if it comes to the point where we're going to have to respond with mitigation, these are the kind of things you might be thinking about, you might have to do. She wasn't telling you anything that you needed to do now. So you need to do nothing different than you're already doing, but she wanted in the realm of transparency to let the American public know if we need to mitigate, these are the kind of things you might want to think of. And that's why I think there's no incompatibility with what we're saying here and what she said.
Thank you, sir. Thanks. And behind Chris here, yes, thank you.
Hi, Jeannie Bauman with Bloomberg Law. Thank you. I wanted to ask about the influenza surveillance system and the use of it, and if you're seeing an increase in flu-like or pneumonia symptoms that end up testing negative, that could potentially indicate that the coronavirus might be circulating, and then separately, when do you think the Sentinel system for the coronavirus might be up and running?
Yeah, thank you for those questions. Our influenza surveillance uses a number of different approaches, and every week we update that data at cdc.gov in FluView. What we're doing is adding a test for coronavirus to the individuals who are presenting with influenza-like illness. We're still in the midst of influenza season, and a very high proportion of those specimens are showing influenza of one type or another. But as we add the coronavirus, we hope to detect before it gets widespread, the occurrence of this if it is out there in the community. We're already beginning this effort in 5 sites, and that'll be kind of rolling out over the next couple weeks, and learning from that how to expand it throughout the nation. So essentially it's adding the PCR or polymerase chain reaction test for coronavirus to the other testing for influenza that the public health labs are already doing in this influenza surveillance system.
Thank you. One last, how about in the back there?
Thank you. I'm Carol Pearson. I'm with the Voice of America. Just for a reality check, I would like to see a comparison between the lethality and transmissibility of this novel coronavirus with influenza, the current strain that's going around. And I would like to also find out if during the Ebola outbreak in West Africa between 2014 and 2016, the CDC helped the Liberian government run PSAs about how to protect yourself from getting this. Given the fact that an MIT study just showed that only 6 to 7% of people wash their hands properly, meaning 15 seconds with soap and water, are there any plans for that?
Thank you. Dr. Fauci, perhaps could you talk about the comparability, or Dr. Shukas, either of you?
Will you do the hands? I'll do the So, Carol, a standard flu seasonal flu, the lethality is 0.1%. Right now, depending upon what the denominator is, the lethality for the current coronavirus infection is somewhere around 2%. You know, if you do different studies that are coming out, 2.5, 2.6, 1.9, about 2%. If you compare it to the SARS outbreak, it was 9 to 10%. MERS was 36%. And then if you go through the history of pandemic influenzas, depending upon the year, anywhere from 0.5, 0.6%. When you get to the 1918, it's 1.5 to 2%.
Yeah, and in terms of the consumer education and hand washing, we are always trying to promote hand washing, and that's a core message for child care kids and for the American public during influenza season. And I would expect to see more of the types of approaches to promoting hand washing, perhaps trying to integrate a little bit more of the innovative approaches and not the old sort of PSA approach.
Great. Thank you all very much, and we're going to keep trying to do these briefings. I want to make sure they're as regular as possible so that you and the media have access to us to get your questions answered. Of course, we have our regular CDC morning briefings approximately 2 to 3 times per week, as well as other events where we've got almost, I think, every single day senior leaders out in the media. But we're going to keep doing that to make sure we're very available and giving you information and assessments as we have that. So thank you very much.
Will Dupree here in the KXAN Live studio. You've been listening to a media briefing from the Department of Health and Human Services in D.C. The HHS Secretary just wrapping up his comments along with some other officials from the Centers for Disease Control. What they have said, though, in this particular briefing was kind of tamping down some of the reporting and the headlines that have went out earlier today from another CDC official saying that almost insinuating that the spread of the coronavirus would be wider here in the U.S. eventually. And they wanted to say and stress that at this point, the immediate risk to people here in the U.S., as they've said all along, is low, saying there's only 14 confirmed cases, and then there are cases involving people, American citizens, who were evacuated out of Wuhan, China, and from a cruise ship in Japan. So we will continue to follow this. This particular briefing is happening, though, at the same time that the U.S. stock market is taking a big hit, and it's really due to a lot of these concerns about the coronavirus. If you take a look at these numbers right here, a drop of 816 points at this point today, but that's likely to change. We've seen that number fluctuate throughout the day, as the coronavirus has apparently shut down production in some companies, and other cases are showing up in different parts of the world, which has led to global fears about this spread. So again, this is something that we're going to be keeping track of and trying to provide the latest information to all of you at home. We do appreciate you watching our live stream. We're going to take it down right now. We'll have some more reporting on our website. That's KXAN.com and the KXAN News app. Thanks again for watching here. We'll see you back here another time.